to this evening's episode of 60 Minutes. Tonight our medical segment features the truth behind acupuncture. Acupuncture is an alternative medicine method from ancient China that treats patients by manipulating thin, solid needles that have been inserted into acupuncture points in the skin.
We will be focusing on the effect acupuncture has on back pain. Back pain is the most common problem people seek out acupuncture for, and 1/3 of acupuncture treatments are for back pain. Western medicine would look to heal back pain using physical therapy. We will compare the benefits and disadvantages between Western medicine and alternative medical practice of acupuncture.
Janine will be interviewing an acupuncturist. On to you, Janine.
Thanks, Michelle. I'm here in New York City with the acupuncturist Joan Connolly, who has traveled all the way from Ireland to be here with us today. How are you, Joan?
Very well, thank you.
I'm good. So tell us about yourself. How did you first become interested in acupuncture?
Well, I used to be a social worker and I worked with children and their families, and it was a very stressful job in London, and somebody said acupuncture was very good for stress. So I went along and had acupuncture and was treated by this wonderful Chinese man who was a really amazing acupuncturist, and he trained people in acupuncture. He had a school, and so I decided to study with him.
Very interesting. What did you have to do to become a licensed acupuncturist?
So what you do is you study for 3 years in respected and recognised acupuncture school, or Chinese medical school, and I did that in London. And then usually most people after the 3 years study, it's equivalent to a degree, you go to China. So I went to China for 4 months and worked in a hospital in China and learned then more techniques. But really I got an awful lot of experience. We used to treat about 100 people a day. So you'd never treat 100 people a day in England or in America because it's just not the volume. But in China people come regularly, so it was like you'd see somebody and there were 10 beds, and then you'd go to the next person, the next person. So it was enormous experience. It was a fantastic experience.
Wow. So how does acupuncture work, like in general and for back?
Okay, how does acupuncture work? Acupuncture has been around for nearly 3,000 years. The Chinese discovered it 3,000 years ago, and it's all about energy. So for example, there's energy in this room, there's energy in your body, there's energy in the plants, there's energy everywhere. I don't understand how the TV works, so if you get the remote control, I don't understand how you press the remote control and then you put the TV on. I don't know if you do. Do you know how that works? So there is something about it. It's a bit like that with energy. You don't really know about it, but it's there. It's a bit like, I don't know how the mobile phone works, but there's a mobile phone network, but it works. So in Chinese medicine, I'll just show you here, are these meridians. They're called meridians, they're energy channels. And there are these lines of energy channels in the body. And each energy channel connects with an organ. So for example, this is an energy channel which connects to the heart. And then this is an energy channel which runs along your leg, connects up onto your liver. The channels are bilateral, which means they both are on each side. There's 2 channels on each arm and each leg, and all the organs have 2 channels. And the idea is that energy moves around your body continuously. And when there's a problem in your body, the energy gets blocked, a bit like a plumbing system in your house. If there's a blockage, the water doesn't flow well. So when these energy channels gets blocked, you might get a headache, you might get a back pain, you might get a stomach pain. And the whole idea of acupuncture is there are points along these energy channels that you stimulate to release the blockage. So can you see that there? Mm-hmm. So basically you stimulate certain points in the body to release a blockage. Does that make sense?
Yeah. Wow. Very interesting.
Okay.
Are there any cultural or spiritual aspects of acupuncture?
There are. I suppose the spiritual thing is about your mind and your body. So in Chinese medicine, they don't differentiate between the mind and the body. So for example, if you're very stressed, that will manifest in the physical body. So, when people have a lot of back pain, you often see it in their face, and they get very agitated, and they get very often depressed actually. So in Chinese medicine, they don't spend a lot of money on focusing on their mind and talking to a psychologist or something. They'll say maybe you need more sleep, and therefore they'll work on your sleep, and then that will affect your mind. So it's more about staying in balance with your mind and your body, if that makes sense.
Yeah, okay. What are the benefits of acupuncture?
The benefits of acupuncture are generally there are no side effects. So for example, you can treat animals, where we've got an animal somewhere around, and they don't have any problem with it. Where sometimes if you give an animal, say drugs, or humans drugs, you can have a side effect. So for example, with horse racing, in Ireland they often use acupuncture for horses because it's very effective for getting the horses back running if they've an injury. And Kaylee, our dog over here, had a problem the other evening because she has arthritis in her hips, and she was exposed to the cold weather that you have now in New York, which is fantastic, but it's nice for us to have the snow, and Kaylee couldn't walk very well. So we gave her acupuncture and she became more mobile. She's an old dog, aren't you, Kaylee? She's 10 years of age. So the whole benefit is that there are no side effects, and that actually it's about just creating balance. So, you know, some people seem to respond brilliantly to acupuncture. Animals respond brilliantly, children respond brilliantly, because they don't have all this tension, where adults sometimes are like this. So they're already in their mind, they're stressed about the idea of somebody sticking a needle in them. And that doesn't help the energy flow. Where dogs, Kaylee doesn't know anything about negative aspects of acupuncture, because the problem is with acupuncture is the needles. You use needles to release the blockage of energy.
Okay. Is there any disadvantages of acupuncture?
I wouldn't say there are disadvantages, but I'd say the disadvantage is that I use these needles, and they're very fine little needles. I don't know if you can see them there. Very, very fine. These are often used for facial acupuncture, so more and more women are having acupuncture to get rid of their lines around their eyes, or these strong lines here around their mouth and their face, or the frown lines. Women often get, none of you people will have lines yet, but in your 50s maybe you might. So these are very good, and these are very good for children, these small needles. And then I often use these bigger needles. The length of the needle doesn't matter as much as the actual, can you see that? As the length, it's more, they're very fine. They're as fine as a hair on your head. So the idea isn't about pain. The idea is actually just to release energy. So some people have had a very negative experience of acupuncture because it's very painful, but I think that's really bad acupuncture. It shouldn't be painful.
Okay. What do most of your patients come to get treated for?
Most people come for, at the moment I'm seeing a lot of people for infertility, but I also see a lot of people for arthritis, for back pain, for knee pain. In Ireland we have very damp weather, so it's very cold and damp, so there's a lot of people suffer from arthritis. So it's for example, people don't need as much anti-inflammatory drugs if you treat their knees with acupuncture than if they didn't have acupuncture. And back pain, a few treatments of back pain and you can resolve the problem.
Yeah, how does it like specifically heal back pain? Is it like...
Well, the whole idea, to go back to my little man, I might need my assistant again to just access this. So the whole idea, say with back pain, there are meridians that run along the back, and these are the kidney channels along here and the bladder channel. And so the idea is the energy is getting blocked here in your back. So what we do is stimulate points along the back, but also often along your ankles, because these are very important kidney points along the ankles, and we release the energy then that way. Does that make sense? Yeah.
Yeah. In your opinion, what do you think is better, acupuncture or like physical therapy?
I think there isn't really a very clear answer to that. Both are really good. I think physical therapy is fantastic because it stretches out people. You know, if they've had a lot of tension, if they're doing a long run, physical therapy is really good for loosening up the muscles. But combination of acupuncture and physical therapy can work really well.
Okay.
But the thing with acupuncture is it's all about maintenance. So the idea is you keep the energy always flowing in your body. You don't let it get blocked. But in the West, we don't usually work like that. We usually go to the doctor when we're unwell. Where in China, they go to the doctor regularly to keep themselves well. And traditionally, you'd only pay doctors when you're well. If you're unwell, the doctors in China didn't get paid because then they were considered not doing their job properly. Does that make sense?
Yeah.
So you really, it's about keeping yourself well. Where in the West, we usually, as I say, go to the doctor when we're unwell.
So, do you have any comments on like the comparison of like Western medicine to acupuncture?
I think I used to be a nurse a long time ago. I think both are very good. I think, for example, if you've got a broken leg somewhere here, there's no point in sticking a needle in a leg that's broken. You need surgery. So Western medicine is essential for that. Or if your leg is really very badly inflamed, sometimes you need steroids to reduce the inflammation. But then acupuncture helps the healing. So you go and get your leg pinned or fixed, and then you promote the healing with the energy by moving the energy around the leg, for example.
Okay.
If that makes sense.
Great. Well, thank you for joining us here today.
You're very welcome.
Much appreciated.
Very welcome.
And back to you, Lindsay.
Thanks, Janine. Now we will go to Brianna and Delia to examine which treatment is better for back pain, physical therapy or acupuncture.
Thanks, Lindsay. Acupuncture is known to work better for back pain than physical therapy. Dan Cherkin, PhD, who is a senior investigator at a group health center for health studies in Seattle, conducted an experiment that involved 638 men and women. These men and women who had chronic low back pain and who had never had acupuncture before were assigned to one of 4 groups. The 4 groups were the individual acupuncture group, in which patients received acupuncture treatment based on a specific prescription for acupuncture points. The standardized acupuncture group, in which patients received an acupuncture treatment that was considered effective by experts for chronic low back pain. The stimulated acupuncture group, in which patients received a treatment that imitated needle acupuncture but instead used a toothpick and a needle guide tube without penetrating the skin. And the usual care group, in which patients continued either taking pain medicine or undergoing physical therapy.
Acupuncture treatments were given 2 times a week for 3 weeks and then once a week for 4 weeks. Back-related problems were then studied at 8 weeks, at half a year, and 1 year after the treatments. The people who had received acupuncture treatments had a better improvement in their back pain than those in the usual care group. Altogether, 60% of the patients treated with acupuncture showed substantial improvements in their back dysfunction, while just 39% treated with physical therapy or usual care did. After a year, the ones in the acupuncture group had better improvements than the usual care group. 65% of the acupuncture-treated patients were still showing improvements, while only 50% of the usual care were showing improvements. In my personal opinion, acupuncture and physical therapy both aim to do the same thing, which is relieve back pain. But from my experience, they each target pain through different methods. With physical therapy, I could feel the effect the stretching and the movement had on my muscle and my back immediately, while with acupuncture, however, the needles were used to control certain energy waves in your body and pinpoint certain pressure points, and you don't necessarily feel the improvement in the pain right away or the needles penetrating your back right away. I had physical therapy done every week for a period of 1 year, and I could immediately feel the improvement it had in my back. Each week I could feel them stretching new areas in my lower back from my scoliosis, and over the period of time my pain was almost completely relieved, but it did come back eventually, and I currently do have more back pain, and I had just gotten acupuncture done recently, and while getting the acupuncture done and afterwards, I felt something different in my back, but I didn't feel improvements right away while the person was administering the acupuncture. I didn't even feel the needles going in, while in physical therapy you feel each movement they're doing, and when I got out of it, I didn't really feel any better. So I think just like physical therapy, acupuncture has to be done over a long period of time, but like the studies show, it's more about if the pain comes back afterwards and after you've had the treatment done. And I feel from what our studies that with acupuncture, it doesn't always come back, and with physical therapy, the pain might return. So as mentioned previously, that with acupuncture, you don't really feel anything being done to you or the needles being put into your back while it's being administered, and with physical therapy you do feel the stretching and you do feel immediate improvement. And we're going to show you a short clip of an example of this done by Joan Connolly. She was giving acupuncture to a dog, and it's just proof that the dog had no reaction to the needles being placed into him, and just it's proof that acupuncture cannot be felt.
This is Kaylee, and she's 10 years of age, and she's a very good patient of mine, aren't you? She loves acupuncture. And she has quite bad arthritis, and last year she was diagnosed, I'm going to ask her owner, with cancer, haven't she? Yeah. So she's made a tremendous recovery. She gets a lot of love in her home, don't you, Kaylee? So all the needles are disposable, so you'd never use the needles again, which is very important if you go to an acupuncturist, to make sure they use disposable needles, because it can be quite, obviously there's a risk of hepatitis or HIV if you use needles. So this is a really important point. Just breathe in, Kaylee. There we are. So, can you see that? Good girl, Kaylee. So this is a very important point to help relax the animal, and I use it a lot with humans who are stressed as well. But as you see, Kaylee isn't stressed at all. So, just going to move in here, and I'm just going to show you. Now, Kaylee, darling, just breathe. Yeah. So again, along her spine, I'm going to do nice points just to help her relax. Can you see that one there? Mm-hmm. And her back, I know it's kind of difficult because of the colour of her fur, her lovely hair. So, Kaylee, there we are, just relax. So the needles are often left in for 20 minutes. And the whole idea is for Kaylee just to be nice and relaxed. Good girl, Kaylee. There we go. Now, that one, obviously, I think on Kaylee's left side, she's a little bit more sensitive. So she was a little bit more sensitive putting that one in. Weren't you, Kaylee?